Ma'am, your voice is not audible. Ma'am.
Yes, can you hear
Ma'am,
me right now?
yes. Yes, yes,
Okay.
yes.
Okay. Good evening, everyone. I hope this session is interactive. I'm going to speak about recent trends on healthcare and AI in this session, and let's see what we're going to go through this session. So we're going to go through the current applications of AI in healthcare and the challenges and the ethical problems which we face while implying the AI in our healthcare and also the future prospects of AI in healthcare session at the end of our presentation. So before we could get into all these topics, I hope you all know what AI is. Um, so I hope this is an interactive session. I don't want it to be a monologue, if that's okay. Hello, am I audible?
Yes, ma'am, you are audible. Participants will message you in the chat box, ma'am.
Okay. Yeah, that sounds well. Yeah. So with respect to AI, it's called the artificial intelligence because we we are able to imply and replicate the behaviorance and the working procedures of an actual human, or not just human, even any living being. It can be replicated into a machine. So that is, a brief of artificial intelligence. And uh, with respect to a human, say for example, if we take a human baby, the baby doesn't know what to do, what not to do when it's being born, and then later on it gets to know certain things when we train them, when we let them know what they're supposed to do, what they're not supposed to do, what might hurt them, what might not hurt them, and all these scenarios train the children, and the children try to learn all these, uh, have and get an inference on all these and in the environment and the scenarios which happen around them, and then later on they grow up and they try to analyze all the situation, like they know that the fire will hurt them when they touch the fire, but the children babies, they don't know. The same way a machine can be trained, and those trainings can be done using mathematical computations, and these mathematical computations can be implemented using programming languages like Python and MATLAB. So for in general, the industries use MATLAB for prototyping. Most of the academic organizations use Python for the prototyping, and also, for all the programming and implying all the algorithms. They have a lot of libraries, tools which can be used to imply these functionalities. So how do we train all these data? So that's the huge question mark which the children have nowadays. And learning about AI is all about learning about train the data, and these data can be with respect to healthcare, these data can be a picture of your brain, a medical MRI or a CT, or x-rays. It can also be various other factors like your blood tests, and all these are all data. So these are all recorded, and these are all used to analyze and to come up with a nice diagnosis, predictions. And you can also use these data to come up with a cure before you could even come up with a symptom of a disease. So before you could get infected with the disease, you can find out that you whether you would be getting a cancer or a diabetes, any metabolic diseases like blood pressure. So all these can be analyzed, predicted before you could even get all these symptoms. You know, so all these can be performed with the help of AI. So let's go through each and every domain where we use, these models, which which can be used to do various perform, which can be used for various purposes. So the first one is the medical imaging and the diagnosis. The second is the predictive analysis of various diseases or a diagnosis. Then you can discover drugs with AI. And this genomic part, that's the best which we could have in recent trends, which we talk about later in our presentation. And then my most favorite is the robotics in healthcare, which are doing wonders, which is even helping doctors to perform medical surgeries in a very accurate and precise manner. And also, we use AI in other healthcare purposes like maintaining the documents, records, analyzing those records, for the patient's goodness. So let's talk about the medical imaging and diagnostics. When it comes to medical imaging and diagnostics, doctors, radiologists, all these medical professionals, even though they put all of their efforts to analyze the images which we get through functional MRIs, CTs, X-rays, we sometimes they do make human error, or it won't be even visible. Those medical diagnostics, like a small hairline crack somewhere in the middle of the organ, a bone, or any minute small tumor which is present in your brains. So these kind of tumors, fractures, and all these medical diagnosis cannot be done by humans if it is quite very small, if it is not, if it is very hard for the human to identify, with a natural human eye. But with AI, we can analyze the images and the videos and use neural networks, the deep learning algorithms, to analyze the data such as images and the videos and come up with a nice diagnosis, quite precise, if we'd like to say. And it does wonders. It can also um, predict the diagnosis and come up with a nice enhanced treatment plans, tailored for that specific patient. Each patient differs. Certain people, they do not have any metabolic diseases like diabetes or blood pressure, but certain people, they do have all those problems. Genetically, certain people have kidney problems, kidney stones. It's very hard for some people for to get rid of kidney stones. It keeps repeating, it keeps coming back again and again. So with those people, these medical imaging, if they take a proper, maybe once in a year, if they take a test, X-rays and MRIs and CTs, maybe once in a year or twice a year, if they could take it. But most medical people, they suggest humans to take medical tests once in 6 months. So when they are, evaluated, so even if before we could get the symptoms, we can analyze our data with AI and come up with a solution before we could get the problems, before we could come up with the disease. For example, there are older women, even I could say women who are 40 plus. So these women do not get to know whether they have breast cancer or not. So they usually find the diagnosis, and they usually experience the symptoms maybe during stage 3B, which is like quite far, and going through chemotherapy and the pain and the agony, it's quite large. And it's quite, tiring too. It puts pressure on their mental health, their physical health, and it not just hurts them, but also people around them too, financially, mentally, even with respect to time. If they have kids, it's a harder for the kids too. So to avoid all those, AI does help us to analyze all these images prior to getting the symptoms, and coming up with the treatments according to the patient's outcomes. Yeah. So next comes the predictive analysis. So that is with the previously we saw the medical imaging and diagnostics, but here, so this is not with respect to images. So this is with invasively, maybe we could say, we could maybe take a bone marrow from a patient, and then we can predict whether the patient has cancer or heart diseases or diabetes, or even if they even if they are not infected with such certain diseases, we can predict beforehand if they're going to experience certain medical issues in prior, with the genetic data which is present in our in our genes. So and we can analyze all these data, and we can come up with a solution before we could even face the issues caused by the medical diagnostics. So analyzing and predicting and coming up with the a prognosis. So these predictive analysis does help in many ways, and it also comes up. Predictive analysis also helps people with treatment plans. So even for each and every patient, the treatment plans can vary based on their own genetic disorders, and personalized treatment plans can do they can help people with their symptoms. And even if if they do not have the symptoms before they could come up with a disease, they can at least change the lifestyle before they could come end up with the disease. And then next comes the drug discovery and genomics, where you can discover the drugs, and you can modify the drug the synthesis and everything with respect to the patient's needs, and the genetic data which is present in a human or any animal. So those data can be analyzed, they can be even modified, and they can also be tailored in a way where people for example, if you are prone to diabetes genetically, you can come up with a medicine which can which can stop you from getting diabetes. So all these can be performed using AI. And we use now in recent trends we use bioinformatics, which is nothing but genetic analysis and genomic analysis with artificial intelligence. We use many algorithms like deep learning, and we use tools like BioPython to analyze and predict the data, the genetic data. And next comes the robotics in healthcare. So this is mind-blowing part of this presentation, because there are so many amazing discoveries and inventions with respect to robotics, clubbed up with AI. Uh, ro- they have People have actually worked on robotics in many multiple amazing ways, where micro robotics, miniature robotics, those models are orally consumed, and these robots can take images and take videos of your internal organs, and it can predict and analyze what's going on inside, and it can come up with a solution, and it can give you a nice detailed analysis. So all these this is just one of the examples of the robotic applications. And the most important part of robotics, AI based robotics, is the surgical robotics, where the robotics are used to perform surgeries in a very nice, accurate way. And this reduces the human error and improves the patient's experience. And the patients can be monitored, and it also helps in rehabilitation, where the patients can come up back with the in a normal way. Usually, after a surgery, it's very hard for a patient to bring back their health. They cannot move around like they used to before, and robotics do help patients in such way. They also are quite useful in prosthetics too, and that's prosthetics is the most uh, you know uh, vital part of robotics, where people use computational neuroscience to analyze your neural signals, and with those neural signals, they'll be able to access your limbic systems, with which you can control certain robotic prosthetic legs or prosthetic hands. Even dexterity can be restored using robotics. So
Ma'am,
these
excuse me, ma'am.
applications, yes.
Ma'am, sorry for the disturbance, ma'am. Ma'am, can you please open your camera? We can have a photo.
I'm sorry, I do not have a camera, as
Participants,
I
please
said
open your
earlier.
camera. Let us have a group photo. I request all the participants to open their camera. Just a minute, ma'am. We can take a group photo, ma'am.
Yeah, sure.
I request all the participants to open your camera. We can have a group photo. And I request the admin team to put a message in the chat box once the photo has been taken. Admin team, put a message in the chat box once the photo has been taken. I think some more participants have to open up their camera. I request all the participants to open your camera for a minute to take a group photo. Admin team, is that okay? I request all the participants to open your camera for a group photo just for a minute. Admin team, you please wait. Let them open the camera. If not, also no issues. You please take a snapshot. The speaker is waiting, so we cannot make her. to wait for a long. You take a snapshot now. If possible, we can take another at the after the speaker ends her session. Thank you, participants. Thank you for the cooperation, and thank you, ma'am, for making you wait. You can continue the session, ma'am. Thank you.
Thank you, Dr. Chitra. Yeah.
Yeah.
So,
Shall I
where
stop
was
our
I?
camera?
Hello?
Yes.
Am I
Yes,
audible?
ma'am. Yes, I'm here.
Am I audible?
Yes, you are audible.
Okay. Yeah. Yeah. As spoken earlier. So all these, you know, robotic uh, systems which are used to enhance patients' experiences. These the organizations which help all these which help people with their experiences are Neuralink, OpenBCI. So these organizations they do lots of experiments and research on these computational neuroscience applications with respect to AI. And next comes the AI in electronic health records. So here, AI is also used to maintain health records of patients and also the providers. In the sense, the nurse, the practitioners, the radiologists. So they're all called providers in general in healthcare sector. So even the people who drive ambulance and the paramedics. So they are all called providers. These providers' data and the patient's data, they are all analyzed and um, organized uh, in such a way that it helps the patient's care and it enhances their experiences and it reduces the time of the practitioner to analyze the data and to procure the data at the right time. So in India, most of us we do find difficulty in transportation, in terms of commutation and to procure the data from scanning organization where they take images of the patient, and then you have to take it to their provider, and then the provider takes a couple of days and then gives an analysis. It takes a long time. So to avoid all those, we also use AI to organize our health records. And the most important factor here are the challenges and the ethical, concerns and the problems which we face. For example, the data which is procured from the patient. So all these data, they do have a lot of personal information, and sometimes certain organizations they misuse these data. So these data can be used by certain insurance companies who take advantage of certain providers, and these data are used in such a way that the patients insurance are being modified according to the patient's diagnosis. For example, if the patient has certain cancer, and these data are used by the company, insurance company to flag certain patients where they make sure that they don't provide insurance. So all these miscommunication and misuse of the data. So to avoid all these, there are certain things which we have to follow. The providers and the patients from the both ends. Yeah. So we should maintain the security and privacy of the data in many ways, where you also make sure that you sign certain agreements with the provider where they use only for the diagnostic purposes, and that the data is make sure that the data is not shared with other organization or third party companies. And the other part of the challenging part of AI predictions is the bias and the fairness. As I told you before, these AI models, it's just like a baby, right? So if you give the wrong information to a baby, the baby would think that that's the right thing to do. For example, when a baby is chewing sand, you don't tell the baby that it's absolutely fine. You should let the baby know that it is wrong. And sometimes the baby, quite frankly to say, you should let them. You should tell the baby that it is quite important to relieve the baby, to relieve herself or himself. But it's not right for the baby to relieve himself or herself in a hallway or in a common space. Rather, the baby should know that it's supposed to go to a restroom or a special space for the baby where it's supposed to relieve itself. So when that is the scenario for the baby, this is an electronic device model which is which is getting trained. So it behaves just like a baby, where you train the data, you train the model with certain very few images. If the baby is used to only certain households, then and if you take the baby to another place, the baby cries, right? So the same way, I know it might sound a little cliche, but I think it might be a right example. Likewise, when you train the model, this AI model, if you train it with very less data, the model cannot come up with the right, accurate outcome. The model needs a lot of trainings, it needs a lot of data, and it can also be biased if it is not fed with different aspects of the data. For example, certain you cannot just train the model with people of age in their in their prime age. You cannot just train the model with data of people who are of age less than 30, and ask it to predict the data, train the model the right way. So you cannot ask the same trained model to predict the data of a person who's more than 50 years old. So the data varies, the outcome varies. You cannot expect the model to give the right prediction. So that's the bias which the AI algorithms have. And of course, the accountability and the liability, which is quite important in these days, where you get sued when you do a certain um, cer- when you do certain things like usage of robotic surgical robotics in the operating room. Suppose if anything goes wrong, like if there's a power cut or if any such thing goes wrong, then the liability and the accountability does it plays a vital role in healthcare, specifically in healthcare. The organization which holds all these proprietorship of these AI models. So they are liable for all the negative outcomes which comes from the wrong predictions. And now comes the future of AI. Um, I would like this part to be an open discussion, specifically from faculties too. Shall we have a nice Q&A session? Hello?
Yes, ma'am. Yes, ma'am.
Yeah. I'd like this to be a Q&A session where we talk about the future of AI.
Yes, ma'am. You can ask the question. The participants will post the answer in the chat box.
Okay. I was wondering if they had any questions.
Yeah, I will ask that, ma'am. Participants, do you have any questions? You want to discuss anything with the speaker? Please post your questions in the chat box. I do not see any questions yet, ma'am. Let me wait for a
Okay.
minute. Participants, if you have any questions, you can post your questions in the chat box. I let the speaker. She can answer your question. You please continue, ma'am. There are no questions.
Okay. That's quite different. Okay. Yeah. Um, yeah. There are quite lot more improvisations which are required in terms of AI in recent days. Uh, Nowadays they are using robotic surgical procedures even for fetus who are not fetus in the sense babies who are not yet born, who are inside the womb. The future is in such a way where the medical provider, the physician gets to invasively treat the child, treat the fetus before the fetus is born. We can save the fetus if it has any I know problems like heart diseases or if it has any neurological issues. So all these issues can be solved by invasively operating on the mother uh, who has the fetus, and you can perform procedures, and in recent times there are good outcomes from it where there have been no complications in recent trends. And maybe if you could there are lots more, but I cannot provide all the information in just an hour. It's quite a lot, and it would be really nice if you had any questions and I could answer maybe on that particular topic.
Kindly post your questions. There is a question, ma'am, asking, can AI help in personalized treatment?
Yes, it can. Yes. So each and every peer person, they have different genetic material, and they have different characteristics. With the help of AI, you can analyze the data which is present in the DNA, and they can come up with a solution even before the patient experiences any symptoms of any disease. For example, any cardiac issues or any metabolic diseases, as I told you before, like diabetes or blood pressure, asthma, and then even certain studies and certain research papers have also determined the prediction of autism and Alzheimer's. These are all neurological diseases. So you can't even say it is a disease, you can say it's a disorder. But all these can be so the treatment for those people, for example, those people, the treatment for those people can be given, personalized treatment can be given. For example, For women, the symptoms of ADHD, attention deficit hyperactive disorder. So this is a neurological disorder where as the name suggests, they are hyperactive and they do lack attention span. So not by by it is not something which they do willingly. It is something which happens without their knowledge, if I could say. So all these can be personalized. All the predictions and the drugs for all these disorders can be personalized for that particular patient. Yes. Yeah, one more.
Yeah.
Roles of artificial intelligence in cancer detection. Yeah, this is a really good question. So, the cancer detection is quite trending right now. So, specifically in UK and US. Mostly in UK. So so you would have heard or read in certain articles that they have found medicine for cancer before they could come up with the symptoms of cancer. There are different stages of cancer, and in each and every stage you might not experience the symptoms, but for certain people, based on their genetic data, they experience in the later phase, maybe after stage 3B or 3C. So when that is the scenario, it's very hard for certain people to come back from the to cure the cancer. They might even die too. So when that is the scenario, it is AI does help to predict the cancer beforehand itself, with the image processing and everything. Yeah, how
Yeah.
AI will help in detecting mental health diseases. Yes, that's quite important in recent trends. Yes. So mental diseases like autism, Alzheimer's. Alzheimer's is a huge thing. It is quite a horrible thing for a person to experience. So all these mental disorders are mostly genetic. So they are all present in your genetic data. So all these data can be analyzed using AI. Yes. Okay. Recently, more kids are suffering with ADHD with mild autism. Yes, absolutely true. Can AI will helpful in the treatment? Yeah, yes, as I told you before, yes. So I've already given you all the information regarding it, but not everything, because it's a huge topic, and they are using different models, different datas which are present. And one more most important part of the challenges which we face in AI is that the data set which we need to train our model. So to procure all those data, it's quite difficult. For research purposes, people like us, like me, who try to procure data for research purposes, it's quite hard for us, because as I told you, there are even people are misusing the data in the wrong, in a wrong way. So to avoid all those, there are restrictions, and there are a lot of issues and complications, and it also it consumes time and effort to procure the data. Yes. And the variation in the data, all variations supposed to be considered to train our model, as I told you before in my presentation. Yeah. Genomics can detect diseases before symptoms appear, which can increase the chances of successful treatment. Can you tell us more? uh, yeah, sure. But I think I just have another 15 minutes. Yeah. Genomics, as I told you earlier, analyzing the data present in the DNA is quite huge. One uses a lot of algorithms and existing data to train the model, and also to write the algorithm accordingly, and to analyze. So yes, it does help in the treatment, and it is quite amazing the things which they do nowadays with respect to that. Yeah. Thank you, ma'am, for the great session. Yeah, you're welcome. Thank you, everyone, for listening so patiently. Yes, thank you a lot. Practical session. I think the university does provide, webinars according to that certain universities, but I
Yeah, ma'am. Thank you,
suggest,
ma'am. One last question to you.
yeah. Sorry, your voice is breaking. Hello, hello,
Uh,
hello, ma'am. Am I audible? Your voice is breaking.
ma'am, I hope I'm audible. Are you able to hear me?
Yes, I can. Yes.
Yeah. Ma'am, thank you for the nice presentation, ma'am. And
Thank
we
you.
have one last question to you.
Okay.
Mostly people working research, having research in this medical field, initially during the research stages, they will get their data sets from any links. For example, like Kaggle, they will obtain their data sets and they will
Yes.
try to build their AI models with it. The
Yes.
question is, after we have built an AI model with the data set from Kaggle, and if you want to test, you want to test that model with some real time data, will it work accurately, ma'am? Can I rely that on that AI model?
I personally, I would not suggest a person to rely completely on Kaggle because Kaggle data might be old, and you need data from an actual provider, and like hospitals or so those data they do have certain organizations they do provide data specific if you ask for specific needs they do provide data but in, there are certain procedures, yeah, and it's quite tiring to procure the data. Yes.
Oh, okay, ma'am. Thank you so much.
Yeah.
Kindly be
um,
connected to us for another 2 minutes, ma'am. We'll again take a snapshot now. Participants, I request you all to open up the camera since we have many more participants who have joined. We would like to take a group photo. I request all the participants to open your camera now.
Ma'am, if you don't mind me I would like to also inform the students about something quite important, which is that you can learn all these through a platform called NPTEL, where you need not pay any fee. You can go through all the videos, lectures on all these recent technologies and tools which are using for all these implications. There are other platforms where you can get free courses. You need not pay any money to get yourself educated on AI. Yeah.
Thank you, ma'am. Participants, I want to inform you that the session is about to complete, and now I will post you three links. One is the feedback link for this day's session, and I request all the participants to fill the feedback link. Along with the feedback link, I will post you two more links. One is the video link, the other one is the general comments about the FTP. And I request all the participants to fill all the three links. And after 5 minutes, after you have filled up all the links, I will post you the test link. So you can take the test and you can submit it by the end of the day. So after you have completed the test, we can update in the Atal portal and you will receive the certificates within 3 to 4 days. So this is the procedure, participants. So please be connected. I'll post the feedback link now. Admin team, kindly let me know once you have taken the snapshot so that I can inform the speaker to leave the session. Is that done? Okay. Thank you so much, ma'am. Thank you for engaging us and give us valuable information in this last session. I once again thank you for giving a presentation to us. Thank you, ma'am.
Thank you very much, ma'am. Thank you, everyone, for giving me this opportunity. Thank you, Raju Lakshmi and team. Yeah, thank you very much.
Thank you, ma'am.
Partic-
Thank you,
yeah,
ma'am.
Participants, you can close your camera. The photo session was over. I'll post the feedback link and other two links now. Please do fill it.
Recording stopped.